Here is part 3 to 1.2 muscular system. Alex, please. Here I am going to be talking about muscle roles, and this involves the agonists, antagonists, those sort of muscle roles. You can see that in the PowerPoint right now. The agonists are known as the prime movers, as they provide the major force to complete the movement. You can see this in a bicep curl, which produces flexion at the elbows. The bicep muscle is the agonist. Antagonists, however, are the muscles that produce the opposing movement to the agonist muscles. Synergists in a movement is the muscle that stabilizes around a joint which movement is occurring, which in turn helps the agonist function effectively. Synergist muscles also help to create the movement as well. Fixator in a movement is the muscle that stabilizes the origin of the agonist and the joint that the origin moves over in order to help the agonist function most effectively. The origin is the attachment site that doesn't move during contraction, while the insertion is the attachment site that does move when the muscle contracts. The origin is usually proximal. The insertion I explained in the origin basically, but it is the attachment site that doesn't move when the muscle contracts, and this is the insertion is usually distal. There are many major muscles in the body, but some of them include the deltoids, which are posterior, anterior, and medial. You have the sternocleidomastoid. You've got the pectoralis major, your rectus abdominis, obliques, your quadriceps, your tibialis anterior, rectus spinae. I'll go into insertions, origins for all of these muscles in the next couple of slides, which I should be able to cover now. The shoulder joint has many different agonistic muscles. Some of them include the anterior deltoid, which its main movement is flexion. Its origin is at the clavicle and the scapula, and its insertion is the deltoid tuberosity of the humerus, and the agonist is the latimus dorsi. The latimus dorsi's range of movement is quite big, as it can do adduction, medial rotation, and extension. The origin is the lumbar ilium and the thoracic vertebrae, and the insertion is the humerus, and the agonist is the deltoid. The pectoralis major main movement is medial rotation. Its origin is at the ribs, sternum, and clavicle, and its insertion is at the humerus. The agonist is the latimus dorsi. The hip joint only has 4 main muscles. One of the agonists is the gluteus maximus. Its main movement is the external rotation and extension. Its origin is at the gluteal surface of the ilium, the lumbar fascia, the sacrum, sarcotuberous, and ligament. Its insertion is the gluteal tuberosity of the femur and iliotibial tract. Its agonist is the ilioposas. The adductor's main movement is adduction. Its origin is the pubis, and its insertion is the femur and tibia. And the agonist is the gluteus medius and minimus. This is the hip joint continued. The tibialis anterior's main movement is dorsiflexion. The origin is the lateral surface of the tibia and the adjacent interosseous membrane, and its insertion is the medial cuneiform and the base of the first metatarsal bone of the foot. And the agonist is the gastrocnemius and the soleus. The gastrocnemius and soleus, however, its main movement is plantar flexion. The origin is the lateral condyle of femur and the medial condyle of the femur. Its insertion is the Achilles tendon, and the agonist is the tibialis anterior. The radio-ulnar and elbow and knee joint. This one is for the radio-ulnar. The agonist for the supinator is the agonist. Its main movement is to supinate the forearm. The origin is the lateral epicondyle of the humerus, and its insertion is the lateral proximal radial shaft. The agonist, however, is the pronator teres. The pronator teres' main movement function is to pronate the forearm. The origin is the medial supracondylar ridge of the humerus, and its insertion is the middle of the lateral surface of the body of the radius. And the agonist is the supinator. The elbow. This one is for the elbow. The agonist is the biceps brachii. And this main movement is flexion. Its origin is at the scapula, and its insertion is at the radial tuberosity. The antagonist, is the triceps brachii. Triceps brachii main movement function is extension. Its origin is the scapula, and its insertion is the olecranon process of ulna. And the antagonist is, of course, the biceps brachii. The knee joint. The hamstring is the agonist, where the main movement is flexion of the knee and extension of the hip. Its origin is the tuberosity of the ischium, and its insertion is the tibia and fibula. The antagonist is the quadriceps. The quadriceps' main movement function is knee extension and hip flexion. Its origin is the rectus femoris and vastus muscles. Its insertion is the tibial tuberosity, and the antagonist is the hamstrings. I'm only going to do 2 for these, which include the internal obliques and the erector spinae. The internal obliques' main movement function is the ipsilateral trunk rotation and compresses the abdomen. Its origin is the inguinal ligament, iliac crest, and the lumbodorsal fascia. Its insertion is the pectineal line of pubis and ribs 10 to 12. The agonist is, of course, the external obliques. The erector spinae main movement is to extend the vertebral column, or whatever. The origin is the T9 to T12 of the thoracic vertebrae, and the insertion is the T1 to T2 of the thoracic vertebrae. The antagonist is the rectus abdominis. And that will do it for part 3, section 3 of the 1.2 muscular system. Thank you.